Taketomi Island in the Yaeyama Island group, Okinawa Prefecture. A peddler comes over from Ishigaki Island to sell pharmaceuticals. His name is Tsunio Tatetsu. But Mr. Tatetsu is not heading for the island's hospital, pharmacy, or drugstore. He is visiting people's homes. Mr. Tatetsu is calling on his good customer, Mr. Tomari, whom he hasn't seen for 3 months. He will check the drugs he left in Mr. Tomari's home last time he was here and receive payment for the amount used. He will top up what has been used and exchange items whose use by date has expired. Pharmaceuticals sold this way are called home delivery drugs. Home delivery drugs are sold by peddlers such as Mr. Tatetsu, representing home delivery drug agents. The home delivery drug agents purchase their drugs from pharmaceutical manufacturers. Their representatives, the peddlers, visit clients' homes 3 or 4 times a year. Sometimes a member of the family might suddenly get a headache or a sore stomach. It's very reassuring to have the drugs for these already on hand.
I've been visiting Mr. Tomari now for 27 or 28 years. It's a long time to be dealing with a customer.
Normally, most people obtain drugs at hospitals or pharmacies. Under the home delivery drug sales system, however, a package of drugs is left in homes free of charge. When the family wants to use the drugs, it takes them out and uses them, later paying only for what was used. A peddler visits the house regularly to top up the drugs and collect the payment. This home delivery drug system has been in use in Japan for around 300 years. Home delivery drugs have maintained the health of the local people. They have also been invaluable in treating illness and injury in areas where there is no doctor. Today, home delivery drugs are attracting attention for their contribution to the self-medication movement, where people take responsibility for looking after their own health. Why have Japanese maintained their attachment to home delivery drugs? Let's follow Mr. Tatetsu around to seek the reason. Mr. Tatetsu has finished his rounds for today. He has visited 15 homes. When he arrives at the guest house where he always stays, he immediately writes up his sales records for the day, entering names in his customer accounting book known as a kakeba. The kakeba records such details as customers' names and addresses, the brands and quantities of drugs left in their homes, the amounts used since the last visit, the money collected, and the date the customer was visited. Using this data, Mr. Tatetsu decides which drugs a customer will need and advises the customer on managing their health. Mr. Tatetsu organizes his drugs for the next day. He consults the kakeba for the area he will visit and prepares the drugs that the people in that area frequently use.
I have been a peddler for 28 years. I serve 1,500 households centered on Ishigaki and including the outlying islands. I visit 500 homes a month, following a 3-month cycle.
Today, the home delivery drug system has spread nationwide. But how did the home delivery drug system start? Japan's home delivery drug system started hundreds of years ago in these areas. Toyama Prefecture is the most well-known region for home delivery drugs. The system began about 3 centuries ago in the Edo period. When Masatoshi Maeda, the feudal lord of Toyama, was staying in Edo Castle in the capital, another lord had a stomach ache. Masatoshi Maeda gave him some medicine that he had with him, and the lord quickly recovered. The many other nobles looking on were impressed and asked Masatoshi Maeda if he would offer the medicine in their fiefdoms too. So Masatoshi Maeda began preparing medicines for the people of the Toyama area and had these peddled all over Japan. The method used in the Toyama fiefdom was to store medicines with the village headman who collected the village's taxes. A peddler from the village would travel around the country on an annual cycle, leaving medicines with households. The following year they would return to collect payment for the medicines that had been used. This was the start of the home delivery drug sales system. The drugs at that time were Japanese and Chinese traditional medicines based on natural substances such as herbs, roots, and bark. As such drugs are light, compact, and sell for a relatively high price, they are ideal for peddling. The medicines of Toyama saved the lives of many who otherwise could not get the drugs they needed. For this reason, the fiefdoms, whose borders were normally closed in those days, were opened just to peddlers of Toyama medicines. Because the peddlers were not making one-off sales but coming back year after year, maintaining trust in their products was vital. To maintain the reputation of Toyama medicines, the peddlers established strict rules of behavior and observed them wherever they traveled. Because Toyama medicines were so effective, they became known all over the country. The production and sale of medicines became a major industry for Toyama. Today, around half of Japan's home delivery drugs are produced in Toyama Prefecture.
The reason that Toyama and other home delivery drugs are so popular all over Japan is because of the convenience of paying later only for the amount used. Under the use first, pay later system, the drugs are handed over with no money changing hands, and the peddler returns later to collect payment for the drugs eventually used. Under this system, the drugs are there when needed, regardless of whether the family has money or not, and thus the system provides reassurance and peace of mind. Because the system places few demands on the customer, since the Edo period, it has been regarded as very important in farming communities, mountain hamlets, and fishing villages. In the Edo period, only great feudal landholders or daimyo and wealthy townspeople could avail themselves of the services of a doctor. The majority of the people who were farmers had no expectation of medical treatment. In these circumstances, Toyama medicines must have been extremely welcome.
The use first, pay later system has remained in continuous use right up to the present day. Older Japanese can remember the medicine sellers of Toyama handing out free paper flyers and paper balloons. In times gone by, when there were few entertainments, children were delighted to receive such gifts.
In the old days, the medicine sellers of Toyama were a valuable source of news. They learned a lot of information as they traveled around the country. In sharing this information, they communicated with a large number of people and were even able to introduce eligible brides and bachelors and offer advice. In this sense, they maintained good communication with the users of their products.
Mr. Tatesu's work for the day is starting. Today, home delivery drug sales are controlled by the Pharmaceutical Affairs Law, and approval is needed to engage in this business. The governors of each prefecture or district in Japan must stipulate the drugs that can be traded and approve the peddlers in accordance with the standards specified by the Ministry of Health, Labor and Welfare. Only only those with the proper peddler ID cards can enter homes to offer their wares.
I became a peddler after someone asked me to help them out because they were too busy. I was reluctant at first, but after a year had passed, I began to enjoy meeting so many people and have kept going right up to the present day.
To become a peddler, you have to train and learn about drugs and ethics. You must realize that your work can have very serious consequences. Taketomi Island has no hospitals or pharmacies. There are only regular visits by doctors to clinics. The most scary thing is having no doctor when you get sick or hurt. If we get sick or injured, the nearest place to go for drugs is Ishigaki. But under the peddler system, we can stock up on drugs and use them as needed.
In the Nakaneku household, there are many children, so they always need cough and cold medicine. And as the children always seem to have cuts and bruises, they need lots of antiseptic solution and plasters. We do not simply sell then leave. We have to get to know our customers over a long period of time. Unless we gain their trust, they will not continue buying drugs from us. We have to study medicine. If we learn enough to respond to their pains and problems, we can advise them. We take this seriously and get to know our customers' needs over a long period.
So when did the home delivery drug sales system start in Okinawa? Home delivery drug agents moved into Okinawa from the mainland during the Meiji period, 1868 to early 1912. Home delivery drugs were a great benefit to the people of Okinawa, but after the Second World War they disappeared. Then, after 1957, they reappeared when regulation for home delivery drugs was proclaimed under the 1957 Pharmaceutical Affairs Law. Mr. Kiyonori Oshiro, the former chief of Pharmaceuticals Division, UQ government at the time, explains.
There was a strong push to start home delivery drug sales in Okinawa. There were quite a few people in Okinawa with experience selling home delivery drugs on the mainland.
The home delivery drug sales system was obliged to employ managing pharmacists, and they could engage only salesmen who had passed the UQ government examinations.
At that time, our companies were structured as corporations. There were 4 home delivery drug agents in Okinawa. We belonged to a company called UQ Pharmaceuticals. The company opened a pharmaceuticals school and trained us there for 3 months. After that, we served an apprenticeship of 3 months. So we trained for a total of 6 months. When this was over, we went out into the field and started working as drug salesmen.
At that time, home delivery drug sales were not permitted in the cities, only in farming and fishing villages.
This was because in the cities there were pharmacies and drugstores everywhere.
Mr. Masaki Nakasone is still working today as a peddler. He worked on Ishigaki Island in the 1960s.
At that time, we traveled in boats. I seem to remember it took about 20 or maybe 24 hours to get to Ishigaki. The roads on the island were very, very rough. We mainly used bicycles, but for distant places we used the bus. Two of us would serve 2,000 or 3,000 homes. It would take 1.5 months to go around them all. Then we would return to the main island. The people were very poor, and sometimes we would hardly collect any money.
Today, Mr. Nakasone visits Ms. Chibana, a customer at that time.
Hi. Nakasone です。お久しぶり。はい、どうも。皆さんお帰りございませんか?
What was the state of home delivery drug sales on the newly settled island of Ishigaki? At that time, we had poor transportation, and so the home delivery drug system was a great boon. We all had many children, so we couldn't get out to buy drugs. This system was a great blessing. With these drugs, we felt reassured that we could live safely on Ishigaki. We always felt grateful to the peddler.
The most popular products were cold medicines, cold remedies, and gastrointestinal medicines. Also painkillers. As these were mostly farming families, they also needed salves and ointments for cuts and abrasions. These were the drugs most in demand.
When Mr. Nakasone came to collect his money and we didn't have it, he would happily wait until the next time, or the time after that. Mr. Nakasone was very understanding and would tell us we could pay when we had the money. That was a big help.
We visited the same families many times and got quite close to them. We had a sense of mission that made us try hard to help them.
What was the state of the home delivery drug sales system before Okinawa was reverted to Japan? Mr. Nobuyuki Nakajima, who still works as a peddler based in Toyama City, researched home delivery drug sales in Okinawa before its reversion to Japan.
At that time, home delivery drugs were not very widespread in Okinawa, but there was great demand from those who recognized the advantages of the system. I was sure that the demand would be there if peddlers offered such a system.
In 1972, Okinawa was reverted to Japan and the system changed. The reversion affected Okinawa's home delivery drug sales in various ways.
Many agents from the mainland came to Okinawa, and competition increased. But this is what happens in business. With the growth of home delivery drug agents in Okinawa, pharmacies in the cities suffered. Those running the pharmacies were not happy. When Okinawa reverted to Japan, the industry was opened up. Managing pharmacists were not required on the mainland, and when Okinawa reverted and adopted the mainland system, managing pharmacists were no longer necessary here. We were very pleased to be able to work without them.
Today, there are two kinds of peddlers: those who operate independently and those who work for a company.
In Okinawa, there are around 35 to 40 independent operators, as against 240 to 250 who are employed by companies. Independent operators source their drugs from the drug makers and sell the drugs themselves. I myself am employed by a company and sell household pharmaceuticals as a company employee.
As the times have changed, the environment surrounding home delivery drug sales has changed significantly. In 1958, the National Health Insurance Law was comprehensively amended and universal health insurance coverage was introduced to extend public medical insurance to the entire population. As a result, the home delivery drug sales industry received quite a blow. Now that everyone was covered by insurance, it was cheap to visit the doctor. People sought medical help for minor ailments and went to the hospitals for drugs. The drugs dispensed at the hospitals, officially known as ethical drugs, are very effective. Therefore, the method of administration and dosage must be carefully controlled by a doctor. In contrast, home delivery drugs can be generally used according to one's own judgment. Their potency is lower than that of ethical drugs because dosages are lower and safe ingredients are used. Also, they are designed to work for anyone. People feel comfortable using less potent drugs. In 1973, universal health insurance coverage was implemented in Okinawa, and the home delivery drugs industry could not escape the impact of this. Medical care was expanded. Emergency medical centers and other facilities were developed, and people could access the medical care they needed. With the growth of nuclear and two-income families, conditions for peddlers deteriorated. Numbers of pharmacies and drugstores increased, and as roads improved, people could easily drive to pharmaceutical outlets. Because of these environmental changes, demand for home delivery drugs declined, and the numbers of peddlers decreased. However, in Okinawa, numbers of home delivery drug agents increased, and in 1995 there were around 60. Customers numbered around 127,000. Today, the percentage of households across Okinawa using the home delivery drug sales system is around 40% of total households. But on outlying islands and remote parts of the main island, this rises to around 90%. The outlying islands and remote areas that could not easily benefit from the development of medical services still depend on home delivery drugs. Home delivery drugs remain one of the many options for medical care. How will home delivery drug agents develop their business in the future?
Home delivery drug sales are targeted at self-medication. The trends in health today are steadily leaning toward primary care, and so users are going in that direction. Therefore, I think we need to focus on such areas as health foods and nutritional supplements.
Recently, ordinary people have many opportunities to get medical information and are becoming more knowledgeable about medical matters. Awareness of health issues is improving. Reflecting this trend, the concept of self-medication is taking hold. This is where the individual, to some degree, manages his or her own health based on a good understanding of his or her own body. In addition, the government is holding down the cost of medical treatment. Primary care, in which a disease is treated at its earliest stages, is being practiced. Home delivery drugs are attracting interest as part of this movement.
I take the concept of self-medication seriously and talk with my customers about this. If an illness can be treated with household drugs, I support this. If a customer tells me that he or she is not feeling well, I might tell them that what they need is more than home delivery drugs and introduce them to a doctor or specialist.
In homes where there is no primary treatment, people who get ill mostly use the hospital. But if people see a doctor only when their home delivery drugs cannot cure them, the burden on doctors is reduced. Home delivery drugs help reduce medical costs and have great potential as a form of self-medication. Because the profit margin on home delivery drugs is very low, each salesman needs at least 1,500 customers to make any sort of profit. So what is the appeal of this demanding job?
There is great satisfaction when I go and see customers in hearing them tell me that the drugs I recommended with confidence really worked. Many of them tell me how well they worked and that what I had told them was really true. This makes me feel happy and useful.
How does the government view home delivery drugs?
Okinawa Prefecture has many outlying islands, and in the past many of these had no doctor or medical services. These islands had no clinics, hospitals, or other medical facilities. Today, the cities have many outlets where drugs and medicines are available. There are pharmacies and drugstores everywhere. But many outlying islands don't have pharmacies or drugstores. Naturally, there are pharmaceutical sales of some limited drugs as patent medicines at grocery stores, but peddlers are highly appreciated because they supply individual households with pharmaceutical drugs and work closely with the community. Problems between agents and consumers in general are conveyed to the authorities in the form of complaints, but I have never ever heard a complaint about a home delivery drug agent. The Home Delivery Drug Industry Association holds regular lecture meetings to improve the quality of its salespeople. This commitment to self-improvement is a big reason for the lack of complaints.
What is the reason that home delivery drug sales have continued for 300 years?
Selling home delivery drugs is a business, but we are really selling our own trustworthiness. This is why our services have been in demand for 300 years.
The following types of management are vital for the smooth running of the home delivery drug sales system. Managing peddlers, which is mainly about training and education of peddlers. Managing quality of drugs, which is about renewing drug supplies. Managing cash account, which is about collecting money from customers. Managing information for health, which is about the customer accounting book, or kakeba. Home delivery drugs play a major role in the primary health care of the outlying islands and remote areas of Okinawa. Home delivery drugs help maintain the health and well-being of households and bring peace of mind.